Diabetes is a lifelong disorder in which a person's body cannot regulate the levels of glucose or sugar in their blood system. I would like to take a few minutes to discuss some of the symptoms and risk factors of a diabetic person. And also, can a diabetic person live a healthy lifestyle? As a mother, I'm always watching out for the well being and health of my children. So, about 6 years ago, I became concerned about my daughter of the increase of the food that she was taking in. She was always eating, always thirsty. And if she would get a sore, it would take a long time to heal. So I took her to the doctor and they done some blood work on her. And they came back and diagnosed her as being a diabetic. They put her on metformin and not the insulin. But they also told her that she had to eat right and lose weight. I wondered how she became a diabetic because I'm not a diabetic and her father's not a diabetic. So we did a little research and we found out that me being under 25 when I had her could have been a risk factor for her becoming a diabetic. Also, later we found out that her grandmother on her father's side was a diabetic. 2 years after she had been diagnosed, my mother was diagnosed as being a diabetic. So it was just destined for her to become a diabetic, I think. But we found it and we caught it in time enough for her to be treated. Can she live a healthy lifestyle? Yes, she can. She has to lose the weight, drink plenty of water, eat vegetables, fruits, constantly check her glucose levels at all times. Eat the right food, no junk food. No, teenagers like junk food, but she had to learn how not to eat that. If she gets hungry between snacks to the chips and stuff, she eat raisins or nuts or something healthy to maintain her glucose level. I urge you, everyone, to check your family history. If you have somebody that has diabetes, get checked. Just take one little stick and get checked. They can tell you, catch it in time, you can treat it. 90% of non-Hispanic Caucasians are type 2 diabetics. So please, I urge you and I plead with you to get checked because you never know. You can be a diabetic. Keep a healthy lifestyle, walk every day, exercise. Thank you. Also, remember that diabetes affects a lot of things in your body. It affects your sight. You can go blind. It can affect your respiratory system, make you hard. It's hard for you to breathe. It can mess with your digestive system. It can mess with your urinary tract. You can get a lot of urinary tract infections because diabetes is a very serious disorder. So it affects a whole lot of things in your body. That's why you have to drink lots of water and eat the right food so it can be digested through your system. It's systematic. In closing, remember that approximately 1 in every 400 children and teenagers have diabetes, and 10.8% women have diabetes, a total of 12.6 million people. So please, I urge you to get checked, get checked.